At Iris, your safety and the safety of your patients is most important. If you have received safety procedures from your organization, you should always adhere to those instructions. In this video, we will provide Iris exam recommendations to supplement the instructions provided by your organization for you, your coworkers, and your patients amid the COVID-19 pandemic. Let's begin with maintaining good hand hygiene. When available, we recommend hand washing for at least 20 seconds with vigorous, complete scrubbing with soap. If hand washing is unavailable or impractical, use hand sanitizer with at least 60% alcohol. Again, this is an area where you should reference your organization's policy. Next, let's discuss personal protective equipment, or PPE. PPE are supplies used by you and your patients to minimize exposure to the virus and the risk of infection. We recommend that camera operators wear a mask or face covering and gloves during patient exams. You should always perform hand hygiene before you put on or remove these items. We also recommend wearing eye protection during the exam, especially if you're using a handheld camera. For example, you can use an eye shield or a pair of glasses. Now, let's talk about the camera. We recommend cleaning the camera with disinfectant before and after each exam. You can clean all exterior parts of the camera with disinfectant except for the camera lens. The lens should be cleaned using the standard protocol as covered in the Cleaning Your Camera Lens course to avoid causing any damage to the sensitive materials on the lens. If you're using a tabletop camera, we recommend cleaning the table with disinfectant before and after each exam. Finally, ask patients to wear a mask or face covering during the exam. As always, in front of the patient, use an alcohol wipe to clean the camera parts that come into contact with the patient before starting the exam. For tabletop cameras, this includes the chin rest and forehead bar. For handheld cameras, clean the eye cup with alcohol. Now we recommend cleaning the camera after each exam in addition to cleaning it before each exam. When you're ready to start the exam, we recommend that you ask the patient not to speak during the test for added protection. Now let's review these steps through a typical exam. We'll demonstrate using a tabletop camera. You may already be wearing a mask throughout the day when working with patients. If you are not, these steps demonstrate when to put on and remove your mask. First, wash your hands and put on a mask and gloves. Ask the patient to wear a mask for the exam if they're not already wearing one. Next, disinfect the camera and table. Use an alcohol wipe to clean the chin rest and forehead bar. Now perform the exam as you normally would. After the exam is complete, clean the chin rest and forehead bar with alcohol again. Then clean the camera and table with disinfectant. Before leaving the room, remove your gloves and perform hand hygiene. Finally, remove your mask and rewash your hands. Disposable breath shields made for your camera may also be available. Contact our help desk if you'd like more information. These recommendations are meant to keep you and your patients safe. However, always refer to your organization's policies for specific guidance. Additionally, we recommend referencing the CDC's website for their most up-to-date guidelines. We thank you for your continued partnership in fulfilling Iris's mission of ending preventable blindness. As always, we're in this together, and we're here to help. Please contact our help desk with any questions.